I would like to introduce you to my colleagues in the MIHAN membership committee and acknowledge them for all the hard work they have done. I'm the president, and my partner in crime, the vice president, is Hossein Jalali. Hossein Jan, would you come up here, please? Reza Alizadeh, our treasurer. Our secretaries, Behnaz Mobahedi and Parib Izavi. They did an extraordinary job organizing this event tonight. We have the honor of having Dr. Mahjouri as an advisory for the MIHAN committee. I would also like to acknowledge Cameron and Nicole Janabzadeh. They have helped us a lot and tremendously for this event. Please join us up here. So, they have spent countless number of hours organizing this event tonight. Please give them a round of applause. Thank you very much. Some of you may remember that there have been attempts in the past in gathering Iranians and people with Iranian ties in organizations, especially people in the field of medicine. Unfortunately, none of them actually materialized. I just want to also emphasize how MIHAN started. The concept of MIHAN started about a little more than a year ago, when a couple of Iranians gathered together and were talking about it's a great idea to have people around and get them together and have regular meetings and gatherings and talk about things in the field of medicine. That chat and social event eventually ended up in serious gatherings and plannings for MIHAN. I also need to mention another name, Dr. Kambiz Kosari, who has left Minnesota a little more than a year ago. He was one of the key people involved in planning for MIHAN. With his work and the rest of the MIHAN committee that I introduced to you, we were able to put the bylaws of the organization together. About 6 months ago, we were able to register MIHAN in the state of Minnesota as a nonprofit organization, and since then we have been able to recruit members. Which I also encourage you to join this organization. MIHAN is from you, for you. So, with that being said, we really welcome everyone who wants to be part of this organization and be active and have ideas about other events and gatherings and networking together. I need to mention Nahasti Motlaq. She did a tremendous job in designing the website. It's a state-of-the-art website. We're very proud of it. And also I encourage you to visit the website and look at our bylaws, read it, and see if that's something that you're interested in. Also on the website, you can get information about membership and become a member. Events like this cannot happen without your help and without your contribution. I strongly encourage you to become a member and also become active. Your membership contribution is the main way of providing these services. I'm going to pass the mic to Cameron. He's going to introduce the website to you and also walk you through the membership process, and believe me, it's very easy to do. Thank you very much.
I'm Ranjan Afzadeh. I'll introduce the website to you very briefly. So the website, as you can see up here, you can all put it in your smartphone so you can visit it often. It's www.mihan-mn.org. As you've seen already, this is the home page. You can look at our bylaws and our board members under this tab. Once you become a member, you'll be placed on this directory with your contact information so that we can all network better and get a hold of each other if you have questions. Registration is very easy. You can either do it online or fill out a form and mail it to us.
My name is Feridun Majori, and because our keynote speaker Dr. Hossein Gharib is going to address two topics. One of that is related to the evolution of modern medical education in Iran. I think it is very appropriate to acknowledge Dr. Mohammad Gharib, who is the father of Dr. Hossein Gharib, and his contribution to the evolution and even revolution of introduction of new medicine to Iran is second to none. And for that reason, Dr. Mohammad Gharib is referred as father of pediatric medicine in Iran. Dr. Mohammad Gharib, that I had the honor of serving in his service as an intern, is very well known not only in Iran but also in Middle East. He attended one of the most prestigious schools in Iran by the name Darul Muallimin. He was sent to Paris, and at the time France was the center of science, and especially practicing medicine was the only place where that was the Mecca for people who could get there. So Dr. Gharib went to France and studied his medical school in France, and then he became an extern at Université de Paris, Paris University. Dr. Gharib, from what I remember, is the first non-French people who passed that test with flowing color. And few people after Dr. Gharib, like Professor Adl and Professor Puya later on, and they were able to pass that exam. Also, he trained thousands of physicians. Most of them are very, very prominent physicians practicing around the world. Dr. Gharib used to say, children and infants, they are not miniature of adults, they are precious and sensitive human beings with having a lot of potential. Also, he created a center for treatment of children, Markaz Tebbiye Kudak. And during his 37 years of dedication and commitment to treatment and also education of the people, I think he did not spare any time, even at the time that he was not feeling good, and unfortunately he was suffering from non-curable disease. Following that, I'm going to introduce Dr. Hossein Gharib, father like son, and we are very proud to have him here. We thank you.
دکتر محمد غریب فرزند حاج میرزا علی اصغر غریب در سال 1288 هجری شمسی در کوچه میرزا محمود وزیر واقع در خیابان امیر کبیر تهران در خانواده‌ای معتقد و مقید به احکام دین دیده به جهان گشود.
Some of the achievements that I can review here with you. He is a professor of medicine at Mayo Clinic, College of Medicine. He is received Star Award from American Thyroid Association, President of American Association of Clinical Endocrinologists, Master in American College of Endocrinology, International Clinical Award, and Master of American College of Physicians, President of American College of Endocrinology, and Distinguished Award winner from the Brazilian Society, and Distinguished Physician Award, Endocrine Society. He has written many books and articles, co-editor of Evidence-Based Endocrinology, a textbook. And last year he was President-elect for American Thyroid Association.
Thank you very much, Dr. Mahjouri, and thank you, MIHAN, for the invitation. Can you hear me? Can you see me?
I hope this trip was worthwhile, and as Dr. Mahjouri said, there are two parts to my presentation. The first one is a 20-minute presentation on hormones, but the utility of hormones in everyday, not only practice of medicine, but also with people who want to get information on what is useful and what should be used, what not. The second part of it is on medical education in Iran, and as you will see, part of it was to highlight the services of Dr. Mohammad Gharib, which already has been mentioned, so I will try to cut that part a little short. The topic here is on hormones and health, and I think that there are a lot of questions that patients ask and the public and patient advocates address. And so those are some of the issues that I will try to review with you tonight. Tonight I'll review with you hormone replacement therapy, the problem of andropause or androgen deficiency in men, testosterone therapy, calcium and vitamin D, and growth hormone. These are usually things that patients, as I said, or public are interested in knowing what should we take and how much and for how long. Now, the process of aging is a natural process, and the question is, throughout the years as we get older, what are the hormones to take, how much and for how long? And we'll try to answer some of these questions. Hormone replacement therapy is the first hormone that I will review with you. Hormone replacement therapy in general is replacement of estrogen deficiency in women. This happens at menopause, or it happens before menopause if there is premature menopause or surgical menopause. So hormone replacement therapy, or HRT, is a term that is in medical science is referred to as replacing the deficiency in women. And because it is hormone replacement therapy, it then automatically will include estrogen and progesterone, the two hormones that stop at menopause in women. Until recently, it was our practice to administer and recommend treatment with HRT for all women who went through menopause. What is HRT and why is it important to give hormones? It's because women at menopause go through a change of life, and they have a multitude of symptoms because of estrogen or hormone deficiency. These include vasomotor symptoms that are characteristically described as hot flashes, feeling hot, nervous, and so forth. They can be urogenital, they can be associated with a dry vaginal mucosa and symptoms of urinary frequency. They can be associated with psychoneural symptoms, which is anxiety and depression or related symptoms. And then there is also the question of bone. As you know, with menopause, there is accelerated bone loss, and so estrogen hormone replacement had as a cardinal feature prevention of bone loss. The question is, what should women know about HRT? Until a decade ago, as I said earlier, it was our practice to routinely administer estrogen to women who went through menopause. If women had symptoms, that would make more reason and need for treatment. If women were interested in preventing bone loss and osteoporosis, there was an added feature. So we always gave hormone replacement therapy to women reaching ages of 45 to 50. In 2002, the WHI, or Women Health Initiative study came out. This was a study of a large group of women. The study was sponsored by NIH. Thousands of women were recruited. Half of them received placebo, nothing, and the other half received HRT. In the middle of the study, after 5 years, it was noted that women who were taking estrogen had an increased risk for a number of illnesses, and those are listed here. That patients who were receiving estrogen had cardiac disease, that they had cerebrovascular disease, thromboembolic disease, and breast cancer. These were significant increases in prevalence in those who were receiving estrogen. The study, which was a 10-year study, was stopped at 5 years, and results came out, and that was the beginning of a change in our thinking and in our practice. What estrogens do, they promote secondary sexual characteristics, and those are breast development, pubic hair, uterine growth, and so forth. So estrogens are important for growth, secondary sexual characteristics. We use the term Premarin as the most popular estrogen. And the reason for Premarin, some of you may know, is the fact that Premarin is equine estrogen, is an estrogen that was extracted from pregnant male urine, and that's why the term Premarin. So that's why it was called. And in 1992, 20 years ago, Premarin was the most prescribed medication in North America. No more. This has changed, as I mentioned earlier.
And so, what about estrogen therapy itself? Estrogen, again, similar to HRT, has advantages. One advantage of estrogen therapy is oral contraceptive for women who do not want to get pregnant. Estrogen is given, and there is minimal risk, but that risk is accepted. And then there is the advantage of osteoporosis, and of course, if there is estrogen deficiency, administration of estrogen replaces that and cures that. But then the risks are present as well. Those are possibility for breast cancer, phlebitis, and the problem of gallstones that are associated with long-term estrogen use.
The next topic is bioidentical hormones. Now, I don't know how many of you are familiar with it, but this is a phenomenon that has developed in recent years, and it is purely an American phenomenon, in the sense that there are those who say that hormones are good, but only if they are coming from natural sources, and those natural sources are yam and soy as major sources, but there are other sources. The claim is that hormones that are currently available from pharmaceuticals, they are synthetic, they are not from natural sources, and therefore they are harmful, and those from natural sources are pure, without side effects, and preferred. These claims by patients and patient advocate groups are not substantiated. Institutions such as Mayo Clinic and also societies such as AMA have said that there really is a lack of evidence for such a claim. But that doesn't mean that there is not support for this in public. And in addition to this, the hormones coming from natural sources, the recommendations are that for those, especially women who take these hormones, you can do accurate measurements by salivary testing, which is very easy. Again, there is lack of evidence for that as well. So the next one is androgen. Men want to claim equality with women, so they keep saying that women go through menopause, so maybe we go through menopause also, so they call it andropause. And so the term male menopause or menopause, or probably the correct way is andropause, is a term that refers to the change of life in men. But as you see here, until the third and fourth decade, the testosterone levels increase, and thereafter there's a decline. Every decade, 10% decline. This is a natural physiologic way that testosterone is produced in men. And so it is rather compared to menopause, it is a process that is gradual and takes time over. Now, testosterone therapy has its place if a man has decreased testosterone secretion and is hypogonadal for whatever reason, that obviously needs treatment. And you may want to know that the male peacock, the secondary sex characteristics in male peacock are the beautiful feathers from testosterone that is produced. Testosterone therapy can be helpful if you are looking for building body. So bone density increases, it promotes fat distribution, it promotes muscle mass, and it promotes increases sexual drive. So in those grounds, testosterone therapy is helpful. But then the side effects are also many. Testosterone therapy causes a sleep disorder because it increases red cells. It may cause polycythemia and the problem with blood clotting. It may increase prostate and promote prostate cancer. The next is calcium. Calcium is not a hormone, but it is something that most of you are familiar with, and there are a lot of questions that are raised in terms of how much and for how long and how to take it. Calcium is an element which is present in 1 kilogram. 99% of it is in the skeletal system, and we need calcium from birth to death. So we need to take calcium. You can take calcium as supplements, or you usually take calcium in dairy products and leafy vegetables. When you take calcium, what happens to it? Usually 1,000 milligrams per day. 80% goes out in the gut into feces. 20% is absorbed, and this 20% goes out in the urine. They believe that anti-aging is something useful, and in any way that you can do it. How can you do it? Well, you can take growth hormone, you can take testosterone, you can take DHEA as some ways to do it. Then you can use cosmetic practices to look young and to feel better. So these are the ways that we are where we are today, and I can only tell you that this is an area that is a big business thing, $40 billion industry, so there is a lot of interest, but scientifically I think you have to be careful in recommending use of these agents and to use them yourself. Now, there were notable graduates of Dar al-Funun who later became famous physicians in Iran, and those include Azar, Alam, Shehrazi, Farzad, Maliki, and Mustafi is a person that some of you may remember. Fatullah Mustafi came to this country in the late 30s or early 40s, and became the most famous urologic pathologist at the AFIP, American Forces Institute of Pathology. Air Force, something like that. Anyway, he was well known, and he died at age 90 or 95 just recently. So Iqbal. So there were many graduates from Darul Funun who entered modern medicine in Iran. Again, continued on. Now, between 1920 and 1940, Darul Funun, the medical school separated from Darul Funun. And in fact, the interesting thing is that the word Danishgah did not even exist in Iranian language. They had to look for a word, so they developed the word Danishgah and Danishkadeh for university and schools and faculty. In 15 Bahman, 1935, or February 4, 1935, Reza Shah goes to Tehran University at what was then termed as Thyroid-related, or actually they called it salle de section. The Thyroid-related. So here is Reza Shah, here is the professor, here are some students, and there is his entourage who officially inaugurated Tehran University with the medical school. There were two groups between 1920 and 1940. Madrasa Tef had two groups, two powerful groups who competed with each other. So it was clear that if you want to have modern education, medical education in Iran, you need a neutral party to come and to administer. And so with the personal approval of Reza Shah, Professor Oberland was recruited. He was a French pathologist and educator who came to Iran in 1938. I'll come back to that in just a moment. And when he came to Iran, he reorganized the medical curriculum, he developed a new curriculum, and he developed the medical school into 40 departments, the medical sciences. The medical school had 28 what they call courses. Each one was a department, so there was a course for surgery, course for pediatrics, and so forth. And each one was given to a capable person to develop, expand, and for future work. Tehran University, which had 200 students at the beginning, for a 6-year program, 1,200, now has 13,000 students registered at the Tehran University of Medical Sciences. In 1986, the medical school became independent, so it left the university umbrella. It became an independent arm with all the medical sciences in it, medical, dental, and so forth. 5 years ago, the Iranian National Medical Museum asked me to donate some of the things that we had, and we gave those to the museum. And then they had a celebration that they developed this. We developed this CD. It is interesting and maybe ironic that the location of the museum itself is in Amirabad, in a small building, a brick building that is said to have been the office of Amir Kabir himself. And since he was a religious person, I have to finish my talk by an ayah from Quran, which reads as follows: وَمَنْ أَحْيَاهَا فَكَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا, which means, and whoso saveth the life of one, it shall be as if he has saved the life of all mankind. And I'd like to thank you for your attention and for your patience. Thank you.